I think that one big trigger is, as I mentioned before, sort of the larger gatherings and big places, crowded places. One of the reasons for that is because people with TBI often have sensory issues, so they might have maybe visual issues, they might be sensitive to noises, or the brain is accustomed to simultaneously processing all kinds of information coming in at once, but after a brain injury, the brain has a much more difficult time filtering out what's relevant from irrelevant. So now it's as if 10 people are speaking to them and it's all the same volume, or 10 things are happening, it's all at the same pitch. And so that's why those sort of situations tend to be big triggers for them. So I'm thinking those might be things like environmental triggers. Other types of triggers might actually be people. So it might be certain relatives, certain friends, certain coworkers. Geez, I don't know. Every time they come over, I can't stand them. I liked them before, but I can't stand them. I don't know why, and they don't know why. But for whatever reason, that person's a trigger, or maybe even their voice is a trigger. Their demeanors, their actions are triggers. Other triggers might be their own internal state. So fatigue. Fatigue is a big one that I think almost tends to really, really influence a person's mood. And and fatigue is common in probably the majority of individuals with brain injury. So I call it the persistent gnat that doesn't often go away no matter how many times you swat at it. So if a person is already feeling tired at baseline, then their tolerance for even simple or mundane things is going to be much less. So now, if you're tired all the time, even dealing with family members, so even if I can avoid other people and other situations, and I'm at home, I'm tired, I can't tolerate information, I can't tolerate thinking as long as I did, I can't tolerate getting up and being involved in physical activities as long as I would like to be. Then without having some sort of physical reminder, it's really difficult sometimes for family members to remember that the person with the injury is at baseline triggered. Now, even simple requests, simple statements can be like nails on a chalkboard for them. So their frustration tolerance is going to be much less, and they're going to be much more likely to snap at the family member or roll their eyes or respond inappropriately.